Hi Courtney, welcome back. How are you feeling today?
Good.
Good. Okay, so a couple of things after looking at your x-rays and your exams. We think chiropractic is great for you and we're confident that it can help you with what you have going on. So before we start your destination to wellness, we're going to go through kind of how the body's healing system can help you and how it can help with how chiropractic can help with your condition. Okay, so if you look here, our spine is built on a communication platform called the central nervous system. And what that does is that it sends signals down the spine, and these nerves communicate with all various parts of your bodies, including muscles and organs and just different parts of the bodies throughout the whole thing. So health problems occur when the communication is cut off or interfered with, just like how we would experience on a phone call. So it's kind of like the body's calling center. So if we were on a phone call and the call is dropped, that's kind of how the nerves work when there's an interference. So the main thing that prevents health and healing in the body is when there's misalignments through the spine, which causes nerve interference, and it makes us not have proper communication between the brain and the rest of the body. So these misalignments can cause mobility restrictions, slow down your responses, and overall just give you a lesser quality of life. So where do these misalignments come from? They actually start when you're born, okay? So anyone who has seen birthing and you're about to go through it can attest to that the baby gets pulled on the neck and head and goes through a lot of trauma, and then as we get, as kids and we play sports and have the various slips and falls, and then as adults we have jobs and we're moving or carrying the kids around, just different things, postural habits, sleeping habits that can relate to those misalignments. So if you take a look at the spine here, you'll see different symptoms based on what you're having, which today is lower back pain. You may be experiencing some of these symptoms, and the reason these happen throughout the whole body, again, is because of that nerve interference and those nerves intervening so much of the body. Okay, so we're going to take a look at your x-rays and we'll kind of go through those, and it will kind of explain more why you're having these misalignments. So go through your x-rays. Okay, so now that we've kind of talked about the problem, we're going to talk about the solution now. So the solution is we're going to set you through a series of chiropractic adjustments, and what those are going to do is we're going to help retrain your spine. So the truth is that your spine has been misaligned for so long, and that it's going to take some time to do this. Okay, so the great thing about chiropractic and why it's been so successful is that it's a natural remedy that we use and treatment that we can use. WebMD did a study for over 2 million patients over 4 years, and there was a 95% satisfaction rate, which that is hard to find any better rate. So it's so successful because it's natural. Our society, we found, has become way too dependent on drugs, and so our solution here is the body's own healing system. Any questions so far with any of that? Okay, awesome. So the solution to your problem is going to be a series of chiropractic adjustments. So the 3 things we're doing when we adjust you is 1, we're removing the nerve interference, allowing the body to have 100% capacity to heal itself. 2, we're removing the nerve interference to prevent future sickness and pain. And 3, we're removing it so that way there's better future performance on the musculoskeletal system, leaving less wear and tear on your body, okay? So we're going to retrain your spine through a series of adjustments. Everyone reacts kind of differently to it. It's going to take some time to get you stabilized, but we're going to break the treatment plan up into 3 different phases. So first thing we want to do, obviously, is we want pain relief. We're trying to get you out of pain, get you feeling better. So we're going to see you 2 times a week for the next 3 weeks. And after this, I feel pretty confident that you're going to be feeling good, and we're going to also add some therapies or whatever we think you may need in order to get out of pain. It's really important though that you keep coming in because you're still in a fragile state, and any wrong move or wrong turn could put you back to where you were in the beginning or even worse. So once we go through the pain relief stage, we'll do a progress exam. Assuming you're doing okay, we'll graduate you, move you to the second phase, which is going to be stabilization. So this phase is even more important than the first phase because we want to make sure that spine is stabilized and that you don't go back to where you were before. So for that phase, we'll see you once a week for 4 weeks. And then again, at the end of that, we're going to do a progress exam and go from there to see if you can go to wellness care. So the ultimate goal with you and with most of our patients here is that we want to get you to wellness care. So wellness care is better than sickness care, and what that means, and we'll make a recommendation for you once you get there, is that we are going to treat the condition or the issue of the spine, the misalignments of the spine, before pain onsets like it did this time. So once we get you to that wellness care, we'll kind of talk about that more, but we want to be able to treat the spine and treat those misalignments before any nerve interference happens, which causes pain later on. Do you have any questions with any of that? Okay, great. So we'll bring you up front and we'll get you scheduled, and it's really important that you make it to all of your appointments so that way the chiropractic can work for you. But we feel really confident that you're in the right place and that you're going to get better through this treatment.
Okay.
Thank you.
Thank you.